Good afternoon, everyone. All right, we like beautiful flowers, but the pollen, it's something that can be much less desired. For many, seasonal allergies are triggered by spring allergens, to include the pollen. So guess what we're going to talk about, the pollen. Today we have Dr. Quinn with us to share remedies to help. So Dr. Quinn, now you mentioned your allergies are acting up already. So what is the most effective treatments to essentially have some relief that you prescribe in your office?
Well, my last patient told me she didn't need any medicine because she uses a teaspoon of honey. Not heard about that medically. But for the prescriptions that we prescribe in our office, I like to do the 4-punch, all right? So the 4-punch includes 2 nasal agents. One is Flonase and the other is Astelin. Flonase is a steroid, nasal steroid, and this is an antihistamine nasal spray. We also like to give, for number 3, the antihistamine such as Zyrtec or Claritin. And then number 4 is a leukotriene inhibitor called Singulair. Those 4 combination of medications work so well, and it will not raise your blood pressure, which is so important. But a lot of individuals, if they need more, we could even look at giving them a small course of steroids.
Okay. What do you suggest then, Dr. Quinn? Because a lot of people are going to ask, as good over-the-counter treatments or options for those that, want to try the pharmacy prior to going to the doctor's office?
Well, note that 2 of the agents that I discussed in my 4-punch approach, the Flonase nasal spray, you can buy this over the counter without a prescription at your local pharmacy. And then you can also purchase the Zyrtec or the Claritin, which is the antihistamine, at the local pharmacy. And for some people, that's fine. They don't need to see the doctor. They're able to take the Flonase along with the antihistamine, which is your Zyrtec or your Claritin, and do fine. And these can be purchased over the counter. The only deal is if you go to your doctor and you get a prescription, sometimes the insurance will cover it. But I suggest everybody start with the pharmacy first, and then if that doesn't work, go see your doctor and we can do more.
Okay, so in that case, when should people be concerned of an infection versus allergic rhinitis, and may they need antibiotics?
That's a good question. And what you want to think about is, number 1, do you have fever? If you have fever, then you definitely need to go ahead and see your doctor. If you're coughing, a productive cough, then you need to go see your doctor. And if you're just feeling very ill and not getting any better, go ahead and see your doctor, because honestly, you need to be tested, because you could even have COVID. COVID is back. You could have the flu or pneumonia or some other infection that will require an antibacterial or antiviral. But at the end of the day, start with the pharmacy. And if you don't have those symptoms, you might be fine. But if you start having severe symptoms, go ahead and see your medical doctor.
All right. Anything else, Dr. Quinn? We have like 30 seconds left.
Hey, just want everybody to remember, this outdoors is so beautiful. I mean, oh my goodness. But at the end of the day, the beautiful flowers, but it brings along the pollen, which is not our friend. My black car is now yellow, and I'm just all day, but I use these medicines, and it helps so much.
There you go. It's like chapstick. Got to have it on hand with you.